I'm Gary Bebow, CEO of WRHS Health System, and this is our August 2015 CEO Connection. I'm really pleased to have with me today Dr. Kumar and Diane Plemons, that is heading up our palliative care program here at WRHS Health System. We started it in early July, and by all accounts, is off to a great start. You know, when I first started looking at palliative care, and we did some research, I was really pleased about some of the things that we could have happen here at White River Medical Center. And one of the most important things, we have leadership, and leadership starts with our clinicians. And I want to get a little background from our clinicians here and how the program's going, and what are you seeing so far. So, Dr. Kumar, talk a little bit about how the program's going so far.
I think there was a large need for the palliative care program here for a long time. Palliative care comes in whenever any individual have a chronic health condition that can usually be managed, but cure may not be possible. For example, people who go on dialysis. For example, certain forms of cancer. For example, certain forms of mental disorders. That's where palliative care comes in a big way. We started this program in order to basically help these individuals, and even though we have had a short run time of like about a month or so, but I think we've been fairly successful so far. We've been fairly busy.
Mm-hmm. Mm-hmm. So, how do people access the program? What's the process by which patients are referred into the program?
The process actually, again, starts with usually a clinician or a nurse. So anytime a patient is admitted that the nurse or the treating doctor thinks that they will benefit from the palliative care program, they refer the patient to that program and by themselves.
Mm-hmm. I know, Diane, you've been really involved in researching it and setting up the team here, mm-hmm. including how does the team work? Obviously, you're an APN on staff, got a lot of experience here, and tell me a little bit about, in addition to yourself, who are the other members of the team, and how do y'all interact together?
We have a team that includes Doc Sperling, who is our chaplain. Crystal Anderson is a social worker, and Robert Martineau is a social worker. And we also have several physicians that are working with us for pain control, people having trouble breathing. We can bring in specialists to help us if we feel the need for them.
One of the things that I was really interested in is that how the quality of life is enhanced for patients who are part of the palliative care program. Talk a little bit about that. How does that intervention work to where those kind of conclusions are reached?
Well, I think what we need to remember specifically is that palliative care is not end-of-life care. That's a common misconception. When we get a patient with a chronic disease referred to us, we work specifically with their symptoms and their illness to provide pain relief, any kind of needs they may need at home, provide resources for them so that we increase their quality of life.
One of the things I've always been real proud here at White River Medical Center is that we've led the state in many new programs and new therapies here. And my understanding is that we're one of the first ones in the state that have a palliative care program
yes.
up and running.
Yes, we are. Mm-hmm.
So I know that as time goes by, others will follow our lead, but I'm always proud that we've got folks like you two that research and get involved and lead us into these things. I know the whole community really benefits from this. So, any other comments or any conclusions you want to reach before we finish today? Anything else?
Yes, I just want to provide you a 2-sentence overview of the palliative care program. The first big part of something that we do in the palliative care is advanced care planning. For example, advanced directive in case you are in a situation where drastic therapies would be needed. It's always a good idea to discuss that ahead of time, just because some people feel very strongly about these. So advanced care directives is one big part of it. And the second big part of it is management of chronic pain. We do have a pain clinic here as an outpatient, but for an inpatient, sometimes things could be improved. So these two are basically the pillars of this program in this hospital.
Mhm. Well, thanks for coming today and giving us a brief review, overview of what the program is, and I know we'll be hearing a lot more about it as time goes on. So thanks for coming today.
Well, thank you for
Thank you.
inviting me.
Appreciate it. It was really great to have Dr. Kumar and Diane Plemons be with me this morning. You know, the palliative care program is something that really can have a great effect on patient care here at the hospital. So I'm really pleased to have them with us. The standard of the month for August is safety. So this month, I hope you'll take some time to really assess our environment. If you see a situation that should be fixed or that we can intervene and reduce the risk of an injury, please be sure to fix it yourself if you can, and if not, be sure to report it and try to prevent some kind of injuries here at the hospital. So safety, it's a good standard to focus in on during the month of August. We have 2 employees of the month to recognize in August. One is Heather McClanahan from Stone County Medical Center. I've met Heather on a number of occasions, and she's well deserved of that recognition. And so when you run into Heather up there at Stone County Medical Center, I hope you'll give her that recognition and congratulate her. At White River Medical Center, Linda Pospisil is our employee of the month. Linda has been with us since May of 1999, and she's being recognized for ownership. You know, I ran into Linda last week and congratulated her on being recognized as Employee of the Month. And frankly, as I said to her then, that I was surprised that she hadn't been recognized earlier. She's been a great employee of this hospital, and our hats a tip to Linda. So be sure to recognize Linda when you see her. During this month, we have 4 new physicians joining our medical staff. You know, it's really important that we have new physicians join us. They bring new talents and fill in voids for services that previously haven't been filled here at the hospital. So during this month, we have Dr. Abraham, a general surgeon, will be joining us, and he'll be practicing with Dr. Lambert. In our hospitalist program, we have 2 new hospitalists join us, Dr. Quill and Dr. Nisha. And then in pediatrics, joining Dr. Melody Moody will be Dr. Guinevere White. I've met all of them, and we are really blessed to have them join us. And so when you see them, be sure to welcome them aboard and be sure to do everything we can to get them into the jobs here at the hospital and so that we can really benefit from their new expertise. In addition to the new physicians that have joined us, we have some leadership changes that will be taking place in August. As our director of surgery, we have Marnetta Jones joining us. Marnetta has had experience as in the head of ORs in the Memphis Methodist system, and so she'll be joining us on July 26th. By all accounts, Marnetta has really been a high performer in that Methodist system, and boy, during her interviews, we were also very impressed with her. And so we're looking forward to having her join us. Sharon Zhang is joining us as a director of population health. Sharon is from Tulsa with a lot of experience in that area. You know, population health is sort of a new buzzword in healthcare, where hospitals reach out more into our communities to take responsibility for improving the health. And you know, at one time, we viewed hospital care as starting at the front door of the hospital and ending when patients are discharged. And so as we enter into this new era of population health, it's really great to have some expertise like Sharon to help lead us in that new responsibility. So be sure to welcome Sharon on board. After 19 and a half years as a director of volunteer, Tina Bledsoe has decided to stay home and take care of her son, Gabe. Gabe is 7 years old, and so Tina will now become a full-time mom. Replacing Tina will be Toy McMullen. Toy's been with us for a lot of years too, most recently in the director in the cardiac rehab department, and after an extensive interview process, The volunteers and our leadership at Waver Medical Center have chosen Toy to be our new director of volunteers. I really know that Toy will do a great job, and so be sure to provide support and assist Toy as she takes on these new responsibilities. On August 11th, Dr. Jeff Angel will be our community health education presenter. The topic this month will be osteoporosis. As many of us get older, that becomes a more meaningful topic for us. And so on August 11th at noon in our conference center, if you have time, come on over and listen to Dr. Angel's presentation. Lunch will be served, and I know it'll be well worth your time. Each year we do prostate screenings in the conference center, and it's really important that we have volunteers to assist during the screenings. Last year we had over 300 men come in for the screening, and as you can appreciate, it's a big event. On September 15th, from 5 o'clock till 8 o'clock, we'll be doing the screening this year, and our marketing department will really benefit from having volunteers like yourselves come in and assist them. So if you're available and you desire to play a role in our community outreach, such as the prostate screening, contact marketing and see if we can, if you can come and assist us during that evening. So that concludes my August CEO Connection. As in the past, if you have some suggestions on how we can improve this and make it more meaningful, be sure to contact us. So thanks and have a great month.